So let's get you more perspective now on the global state of COVID vaccinations. I'm joined live via Skype by Dr. George Benjamin. He's the Executive Director of the American Public Health Association. Always good to have you on.
Hi, how are you, Rachelle?
Good, thank you. So let's start with this Delta variant. What do we know about this variant, as well as the vaccine's efficacy against some of these new strains?
Well, we know that this variant, which originally was found first in India, now called the Delta variant, is a mutation, and it continues to mutate. In fact, they're now beginning to see a different mutation in India from this Delta virus. It is a highly infectious, and in some quarters believe that it may even make you a little sicker than the wild virus that we saw initially.
So then with all these new variants coming out, where does the world currently stand in its fight against COVID in terms of vaccinations and treatments?
Well, we're fortunate that the vaccine still to be highly effective against this variant. It does degrade some of the tests and some of the antibody testing, treatments that we have as well. It does not work as, some of those treatments do not work as well with the Delta variant. But the vaccine itself so far is holding up. The concern is that if we don't get enough people vaccinated, then we will have more mutations, and that there's a potential for this virus to mutate itself away from vaccine protection.
And to that end, we have seen a lot of pledges to share vaccines with poorer countries or regions that are unable to access vaccines. But are those vaccines right now reaching those most in need?
Not really, and not at all. We really have lots of pledges. Vaccines have been donated, but we're not yet getting those shots in arms. So having a vaccine and donating a vaccine is not the same as getting those vaccines in shots in the arm in all of those communities.
Now, another complication, I'd like you to help the audience understand what we're seeing with these so-called breakthrough infections, where vaccinated people are testing positive in recent weeks, and some of the symptoms that they're experiencing.
Well, of course, we know the vaccine is not 100%. No one's ever said that it was. But what it does do is that even if you get infected, people aren't getting real sick and dying. That is what the vaccine's best used for. But it also can dramatically reduce you from getting infected. But again, it's not 100%. So what we have is now and then someone gets what we call a breakthrough infection. And that means that the vaccine doesn't fully protect them from getting the disease. But they're not getting very sick when they get it in most cases. And they're not transmitting that virus to other people as easily.
And certainly very important. I want to look now at President Biden's July 4th vaccination goal. Put that into perspective for us and why you think it's on track to fall short of that deadline.
Well, if you think about it, we had about 5% of the U.S. population vaccinated when the president took over. And now we're over 60% of the population vaccinated. That's a really good start. He made an ambitious goal to get 70%. It was a symbolic goal by July 4th, so that, that's our Independence Day. But we're going to be pretty close. They won't get to 70% of all people, but they will get, for example, probably 70% of those 27 years of age and older. So it was a goal to reach, but it's, it's not yet achieved. And by the way, we can still do it. It just looks like the number of vaccinations we're doing every day have fallen off from the 3 million a day to only about 1 million a day. And so we're projecting that we won't meet that goal.
Now, there are always going to be some people who are just going to hold off on having this. And even though there are lotteries and other incentives, they've been trying to really make people get the vaccine. Why are people still hesitant to get the shots? And what, if anything, do you think might win over some of these holdouts?
Well, there are several groups. There are those people that still are just curious and just don't have enough information to get the vaccine. There are some people, by the way, who just simply hadn't gotten around to it. They have no opposition to getting the vaccine. They just haven't figured out how to fit it in their day. So we need to do a couple things. Number one, we have to do more education on those people who have not yet agreed to get the vaccine because of concerns. And the second group we have to do is make it easier for those people to get vaccinated that just simply hadn't gotten around to it. And that's going to happen more and more as businesses require it, as people want to get together and their friends and peers are saying, look, I want to come and hang out with you, but if you're not vaccinated, I'm not going to do so. And, jobs giving people the time off to go get vaccinated will, I think, ultimately get us to that goal.
All right, well, thank you. Always great to have your insights. Dr. George Benjamin there, Executive Director of the American Public Health Association.